This lecture is going to be concerned with Introduction to Quantitative Research. Slide 2. There are several considerations that we want to look at in quantitative research, and I'm going to go over them in this lecture. One is objectivity in the conceptualization of the research question, the type of design chosen, accuracy as related to this study, whether or not it's feasible to even do this study, control and intervention fidelity, and very importantly, internal and external validity. Overall, quantitative researchers want to be objective so that they can control and eventually predict the phenomenon about which they're interested. Objectivity can be achieved from a thorough review of the literature and development of a theoretical framework, and we discussed those a couple of lectures ago. The literature review should be presented so that the research reader can judge the objectivity of the research question. Just so that you understand more about an objective research question, I'm going to give you an example. A subjective research question would be, why is John so fat? A more objective purpose of a study would be the effects of changing standard white bread and drinks with high fructose syrup for whole grain bread and 1% milk on obesity rates in children ages 10 to 4. Now you can see from those two questions, the one, why is John so fat, is going to be very hard to measure, where with the other one, we can measure several things in there. High fructose corn syrup can be easily measured. 1% milk can be easily measured. And obesity rates in children ages 10 to 14 can be easily measured. Now, the purpose of the research design is to provide a plan or a blueprint for testing research questions and hypotheses. It involves structure and strategies to maintain control and intervention fidelity. Now, there are basically 4 categories of research designs that we are going to look at when we discuss quantitative research. At the very top of the heap is experimental. Right under that is quasi-experimental, and underneath quasi-experimental is correlational, and finally at the bottom of the heap are survey studies, which we're going to learn are descriptive or descriptive comparative. Basically, as you move from the descriptive comparative designs all the way up to the experimental type studies, you increase the control in the research study. Accuracy is accomplished through the theoretical framework and the literature review, and to make sure that all aspects of the study systematically and logically follow the research question. Now, these are a little bit above your pay grade. You're going to have to be somewhat concerned with them, but usually this is for master's or PhD paired researchers. Feasibility is another component of the quantitative considerations that is mainly aimed at the researcher herself. She's going to be interested in time, obviously. Is there enough time to complete the study? Are there a sufficient number of eligible subjects? And is the facility and the equipment availability there for her? This information is generally not addressed in the article itself when we're going to be reading them. Also for the researcher, she's going to want to know, is there enough money available to actually finish the study? And as far as experience goes, the study should be based on the researcher's experience and interest. And finally, She needs to be concerned with ethics. And we're going to, as you saw in your second lecture of this course, ethics is very important. And the researcher needs to know that all the participants' rights have been upheld. Now, control is a huge issue and a huge concern for quantitative researchers. It is achieved with steps taken by the researcher to hold the conditions of the study uniform and to avoid or decrease the effect of intervening and extraneous or mediating variables, which, remember, those things going to muck up the study, on the dependent variable or the outcome. Intervention fidelity ensures that every subject receiving the intervention or treatment receives the identical intervention or treatment. Because as you can see in a research study, if you give some of the people maybe 100 milligrams of low pressure, and you maybe give other people 75 milligrams of low pressure, your outcome, or the blood pressure variable, may change depending upon the number of milligrams that you've given the person. Intervening, extraneous, or mediating variables are those variables that occur during the study that interfere with or influence the relationship between that independent and dependent variable. And like I've said over and over, it mucks up your study. So an example of this would be, let us say you went out to a very rural area that had no internet, had no cable TV. So you decided you were going to set up a program to educate young women on how to best take care of their nutritional needs during pregnancy. And you have your study up and running, and all of a sudden, Comcast appears. And lo and behold, on one of the Comcast stations is a program concerning better nutrition for pregnant moms. Well, now, when you come to the end of your study, you're not going to know if the person in your study has actually benefited from your intervention or whether they benefited from watching Comcast TV channels on the same subject. So those would be the ways that you can muck up your study. Now, intervening and mediating variables are processes that occur during the study, such as if we were going to determine if self-monitoring of blood glucoses and maintaining tight control of glucose levels led to a reduction in hemoglobin A1Cs, the mediating variable may be social support. For example, parents giving positive reinforcement for self-care. The extraneous variables, which we just talked about a minute ago, might be that the strips aren't reliable, or maybe the needles to inject your insulin are dull. Extraneous variables usually are unexpected, surprising events that occur in the study, whereas intervening and mediating variables are something that the researcher might think was going to happen, therefore she can try to control them. Well, how do you control for those little darn extraneous variables? One is you can use a very homogeneous sample, and the other is by using consistent data collection procedures or constancy. What homogeneity means is that participants in the study are homogeneous or have similar extraneous variables that might affect the dependent variable. Thus, it kind of cancels them out. However, homogeneity of the sample limits generalizability or the potential to apply the results of the study to other populations. For example, if you were looking at heart disease in men and wanted to know if giving Lipitor decreases the chances of an MI, you may get a different result than expected, since younger men in the sample may have less heart disease. So you say to yourself, well, then let's just limit our sample to those men aged 50 to 59. But if you do that, then you limit your applicability of your findings. We're going to talk a lot more about this later in the course. Now, we've talked about this before, that the independent variable is the variable that the researcher hypothesizes will have an effect on the dependent variable. It is usually manipulated in the experimental study, but sometimes cannot be manipulated, and that's where we're going to talk about study designs where they're non-experimental. In our case here with our study on having MIs, Lipitor is the independent variable. Furthermore, the independent variable is manipulated by means of a program, a treatment, or intervention done to only one group in the study, and that's the experimental group, where the control group gets standard treatment or no treatment. Most often, patients will get standard treatment if they're in the control group, because it is unethical not to treat somebody who has a disease just to see what would happen versus your experimental group team. Now, the dependent variable is a factor, trait, or condition that can exist in differing amounts or types. It is not manipulated and presumed to vary with changes in the independent variable. It is the variable the researcher is interested in explaining, and in this case it would be our MIs, and that would be the dependent variable, and increasing the intake of Lipitor is our independent variable that has an effect on the outcome variable, being the MI. Randomization. That's Professor Florzak's biggest bone of contention, and you're going to be hearing an awful lot about randomization in this course. Randomization is where each subject in the study has an equal chance of being assigned to the control group or to the experimental group. It assumes that any important, intervening, extraneous, or mediating variables will be equally distributed between the groups. And what that does is it minimizes the variance and decreases selection bias. And we're going to learn all about that in this course. Internal validity is very, very important to quantitative research. And what it does is internal validity evaluates whether the independent variable really made the difference or the change in the dependent variable. And it is established by ruling out other factors or threats as rival explanations. We're going to go over several threats to internal validity, but the first one is history. History is an event, other than the intervention, that might have an effect on the dependent variable. The event could be either be inside or outside the experimental setting. For example, in our study on the effects of Lipitor, maybe we had a whole city, decide that from now until 2050, they were going to have a campaign to reduce the amount of fat in the residents' diets. Well, a lot of things could happen between now and 2050 that would muck up our study. One is maybe they're going to find a better drug between now and then that will replace Lipitor. Or there are a lot of people that maybe move out of the city. Maybe a depression occurred and they don't have jobs here, so they move away. Now that's going to affect your outcome. And possibly the rate of poverty increases in that city so that the government doesn't have enough revenue and they can't pay for the Lipitor anymore. So history can have a huge impact on your study if you have longitudinal type studies. One. Now, another threat to internal validity is maturation, which is developmental, biological, or psychological processes that operate within an individual over time. These processes are outside of the experimental study. And in this Lipitor study, maybe we have a lot of young men in their 20s. And having raised a son, I can tell you that they tend to like to eat whatever it is they want, including jelly donuts and other things that have a lot of fat content. But in their middle years, they tend to get worried more about their health and concerned with heart disease, so they start on a low cholesterol diet. Well, that's going to have an effect on the outcome in the study, which is the number of MIs, that is not related to taking Lipitor. Another threat to internal validity is testing. And testing is taking the same test more than once can influence the participants' responses the next time the test is taken. Such as in your adult class, if you took exam 1, then came out of the exam, talked to your friends, and then a couple of days later went back in and took the exam again, you're probably going to get a better outcome. 3. Instrumentation is another threat to internal validity, and that is changes in equipment used to make measurements or changes in observational techniques may cause measurements to vary between participants related to treatment fidelity. Such as if we're looking at markers for MIs, we used to do CPK levels, but if you've had any of your adult med-surg content on heart yet, you'll know that CPK levels are not only elevated in MIs, but they're also elevated in injuries to the brain or to muscle tissue. Whereas troponin is very specific to heart disease. So that if you're measuring an outcome, you want to measure it in terms of troponin because it's very specific to that outcome. Whereas CPKs, there may be other things that are leading to increases in heart disease. 4. Now, mortality is the loss of study subjects. And in some studies, it actually can be where patients die. I worked on quality of life in heart transplant patients at Loyola probably 15 years ago, and we actually had an awful lot of our participants actually die. But it also means, as far as mortality, is people may agree to participate in the study, but then they don't have the time, so they just drop out. Selection bias is also another threat to internal validity, and that's where the researcher chooses only those people who have some aspect that's going to have a huge impact on their dependent variable. Such as if you went down to Lower Wacker and you found all types of people down there who had type 2 diabetes, and you were interested in whether taking care of their nutrition, giving them their medications on time, and enrolling them in exercise classes was going to decrease their hemoglobin A1C, you're probably going to find a huge difference because their hemoglobin A1Cs are going to be very, very high from the beginning. Whereas if you went to up on the North Shore to possibly a diabetes center where it is assumed that people take better care of themselves, your interventions might not show that huge of a difference because their hemoglobin A1Cs are probably more near normal. So if you got to stand in front of the blue suits and say, hey, look, I want your money, and then you have to go back and stand in front of them and say, well, this is the evidence I found, you're going to want to have the biggest bang for your buck. So you go down and you gather up all the people on Lower Wacker. But this is actually not legitimate research. What I want you to remember about external validity for this course is that it deals with the ability to generalize the findings outside the study to other populations and environments, and that it involves random selection. And now I want you to move on to experimental and quasi-experimental designs, which is Chapter 8.